Most people think Medicare is a catch-all insurance plan, and once you get Medicare, you're covered. Unfortunately, that's really not the case. One of the biggest surprises people discover once they get onto Medicare is original Medicare does not cover dental. That means things like your routine cleanings, fillings, crowns, implants, and most other dental work are generally not covered at all by Medicare. So how do you protect yourself? In this video, I'm going to explain exactly how dental coverage works with Medicare, what your options are, and how to choose the best solution for yourself. I made other videos explaining the different parts of Medicare, and you should probably understand that. But if you're new here and you just want a quick refresher, I'll give you a basic summary and bring you up to speed. So, original Medicare is what you get directly from the government. You get a red, white, and blue ID card, and it says Part A and Part B. Part A and B together is original Medicare. Now, traditional Medicare alone does not cover routine dental, and so you really have two options to get dental care. You can enroll in a Part C plan, which oftentimes will include the dental care in that, or you can keep your traditional A and B Medicare and buy a standalone dental plan on top. So I'm going to go over how each coverage option works and some of the pros and cons that you should know about with each. Now, I want to clarify there are a few rare exceptions that Medicare actually does give some dental coverage. For example, if you're hospitalized and the dental treatment is medically necessary as part of another covered procedure under Medicare, for example, jaw reconstruction after you had an accident. Original Medicare in that case may cover a portion of the treatment, but the routine dental care things that you typically think of, like your fillings, crowns, root canals, and annual cleanings, are not covered. Now, it's important to understand when you're looking at Medicare Advantage that the dental benefit portion is not the same on different plans. For example, two plans may both offer, let's say, $2,000 in dental benefits, but one of those plans may be 100% coverage up to that amount, where the other one may say we cover preventative at 100% and we only cover comprehensive services at 50%. And different plans can limit what services they do or don't cover. So some plans may cover just x-rays and cleanings and give no coverage toward things like fillings or crowns, root canals, some of the more expensive services, where others may fully cover that. You really need to look and read the plan summary of benefits to make sure that you understand fully what the dental coverages include. And with Medicare Advantage, since it is kind of an all-in-one package, you need to look at the plan holistically and make sure that your medical providers and your drug coverage is factored in. Now, not everybody needs drug coverage. Sometimes, let's say, for example, you're a veteran and you can go to the VA to get your prescriptions. There are plans designed that do not include the drug coverage and offer maybe higher dental benefits or other rebates to offset the cost. So when looking at Medicare Advantage plans, it's not always the one with the highest dental benefit amount. It's the one that covers the most things and also fits your healthcare needs holistically. Now, the second option is to keep your original Medicare and purchase a standalone policy for dental. Now, unlike Medicare Advantage plans or Part C, these plans are just totally separate individual plans for your dental needs. Now, oftentimes these plans are going to be bundled with vision and hearing because those are the other two categories that are commonly needed and also not covered under original Medicare. But whether you buy just a standalone dental plan or a combined plan that includes vision and hearing coverage, it's the same, where this is a separate product from your Medicare that gives you coverage for those services. Now, one of the biggest advantages to this is it's not tied to your medical, so it doesn't limit your doctor network in any way, and it allows you that flexibility. Now, one of the things that you have to understand about these standalone plans is that they're funded from the premium that you pay each month. Medicare Advantage or Part C plans often have a lower upfront cost because when you enroll in them, Medicare or the government is paying the insurance company to manage your benefits, and they're giving you a portion of that in like your dental and hearing coverage. With the standalone plans, there is no government rebate to the insurance company, so there's usually higher out-of-pocket premium costs compared to the Medicare Advantage. With that said, there's also going to be things like waiting periods. So let's say that you enroll into a standalone dental plan and immediately need a crown. Usually the Usually these plans say, we don't cover or we don't offer full coverage until you've been with the plan through the waiting period, which can be anywhere from 6 months to 3 years. A lot of plans have a tiered structure, so the longer you're with the plan, the better your coverage gets because you've paid more premium into the plan. And most of these plans have an annual maximum. So once they've paid out a certain amount in benefits, you're capped. That's similar to the Advantage plans as well, but the waiting period is the bigger difference. Now, it's important to understand that whether you're going with a standalone dental policy or a Medicare Advantage dental policy, you need to check that your dentist accepts that insurance. So if you're happy with original Medicare or your Medicare supplement with original Medicare, adding a standalone dental policy may be the easiest option for you. The key really though is picking your Medicare plan first based on your medical needs and then factoring in the dental. Specifically with Medicare Advantage plans, oftentimes you'll find a few good plans that are pretty similar on the medical benefits, and the dental benefit can be the deciding factor because sometimes the coverage amounts there will differ by thousands of dollars. The biggest mistake that I see people make is only looking at the overall big picture number. For example, I remember there was a plan one time that advertised a really high maximum out of pocket on the dental benefit, but then it restricted basically the services you could get and it had crazy high co-insurances. And so you were better off getting a much lower maximum out of pocket benefit but having full coverage because there's really no way to hit that really high benefit amount they were offering with all the restrictions they'd put in place. And so taking a few extra minutes to read through the full summary of benefits on the dental section and understanding how the waiting periods work when looking at standalone plans can save you thousands of dollars and make sure you have access to the healthcare you need. Your dental health is part of your overall health. Good dental health doesn't just help keep your smile bright. It affects your nutrition, your heart health, your confidence, and your overall quality of life. If you've been putting off dental care because you thought Medicare wouldn't cover it, I hope this video showed you that you do have some options. Now, every situation is different, and the right choice really depends on your healthcare needs, your budget, and the type of dental care you need and expect in the future. If you have questions about your situation specifically, I would love to meet you and go over any questions you have and some of your options. You can book a free consult with me at the link in my description below or the link in my bio. Thanks for watching, and I'll see you in the next video.